And then I'm going to design a simple island pedicle flap, something like this. And we're going to have the direction of movement like this. And we're going to keep it on a pedicle underneath. That's going to supply the blood supply, but we're going to swing it forwards. So let's see if we can first incise this hole. And the incision feeling is quite similar. Adjust the light there. Quite similar to real life. I'm going to try and keep it pretty straight. And then with this sort of floppy skin, we're doing like a sawing can opener kind of. Movement. Something like that. So in real life we're going to get this fat layer, aren't we? We're going to want to get a bit of a fat layer underneath it. And this is, the fat cuts very nicely, very, very similar to real fat actually, sort of in almost sort of planes. You can see that, it's looking very good. And then we're going to incise our flap. So let's do nice scoring of the surface first. I'd say this was a bit more rubbery than sort of cheek or forehead type skin or nose skin usually is, but it's pretty good. It's more like neck skin really, or maybe a floppy temple. So let's get all that. We're going to release that end. Okay, we're going to get that fat there. And then what we would normally do is find a skin hook. Right, so then we're going to grab the leading edge with the skin hook and we're going to pull it and see if it moves. So it doesn't move very much. So we're going to enlarge this, we're going to deepen this. Now in this model, we've got voluminous fat, a bit like a cheek or maybe certain parts of limbs. So we've got lots of space and you can actually bring these out as like wings going this way and this way if you don't want to risk kind of cutting into your fatty pedicle. We can go that way a bit and increase the base of the pedicle, and that will make it move just a little bit, just deepening it like that. Just deepening it will just make it move a little bit better. You can see that. And this leading edge is going to sort of, as we bring it forward, is going to want to dive down. So we're going to have to release a little bit more at the front edge than at the back. And there is a sort of stepped design where you can cut into the pedicle high and low to kind of create a Z in cross section that then steps it forward much more. But you do need lots of fat for that and to risk the pedicle. So I'm going to do it the traditional way here, where we just keep that pedicle underneath. And then what you need to do is just basically keep releasing it as much as you dare without cutting into your pedicle. Release that tip. And then you may undermine around the edge. Here's some more tenotomy scissors, better for undermining. So you might go around here a bit, might go around here a bit, might release that tip because this is going to have to come together behind it. It's going to pinch together behind it as this comes forward. So we're going to want to be able to get our buried stitches in there. And this undermining is quite realistic. We can do sharp, we can do blunt, both works. You can hear the tearing, which is very similar to real fat, actually. And that's what we might do, vertical, less traumatic, horizontal or sharp if we know what we're cutting through and we can see. That's nice. And we're going to widely undermine all around, especially the defect, because if you don't do that, there's not going to be a coherent scar between the flap and the edges of the defect, which is going to promote trapdooring. It's going to stick up. So we want a stabilizing scar that goes from underneath the flap to the wound edges all the way around and just holds it and stabilizes it all. Okay, so that's nice. Now let's see how it moves now. So it moves a bit more, but it's still kind of stretching. We don't want it to be tight because that's going to affect the vascularity. So let's go back to this pedicle and just divide it a bit more and just loosen it. And you can see it just by doing this kind of undermining, it just moves more freely. And this is a very good model for what happens in real life. And I haven't had to cut into the pedicle at all to get this to move, so that would be adequate. We might cut a bit here to stop this from submarining down. I might cut a bit. And if it's too tight, you're basically going to have to cut a little bit of that trailing edge of the pedicle just to take tension off, but you've still got enough pedicle in the middle to support the blood supply. But that just takes that tension off. And that, I'm pretty happy with that. You can see it's poking up now, but we can stitch that out. And then we're just going to stitch that together, and it's going to produce a sort of almost a Y shape. So I'll do a couple of stitches just to show that. So then you can either position it with some surface sutures first, so that you know where you're going, or you can start doing your buried stitches. Now you can stitch this together without buried stitches, but I recommend strongly you don't, because you're going to get trapdooring. That's the surest way. So I'm going to use a normal nice buried stitch here, the leading edge, you see that, but and make sure that it's at the same level so it's going to not dive down. I'm using this non-absorbable stitch just so you can see it, obviously, because the others tend to be less. So let's make this nice and tight so you can see it's springing away. So I'm going to use my normal tension relieving tie and then slip that down and then finish off. I've left too long on the stitch here. I'm getting losing concentration on that. So there we go. Anyway, get that down. And we can see that it's coming into position. We've got nice eversion, but there's a little bit of, we've got to help it here and here, and we're going to have little triangles to chop off. But it's in position, so we can see it's going to move and it's going to fill the defect without too much distortion. So that's what we need to do. And we can see that we can pull this behind. So we can either close that very tip, or we can do a tip stitch, or you can do stitch here and here. Whatever seems to work best to get it into the position that you want. Sometimes if you start stitching at this end, it's going to bunch up and it won't be looking nice where you want it to be. So, do what seems best, but you need to bring these together. So, we could do, there's all sorts of things we could do. We could try a tip stitch here just for interest. Let's do a little buried, I'm going to do a buried tip stitch. So I'm going to come in there, not through the surface. Grab that a little bit, make sure we go through the dermis at the same sort of level, out the other side, and coming out about there. And we don't want this to be under too much tension, but it probably needs to be pulled down a little bit. So we want it to not be right through the very tip of this flap, because that will probably strangle it. Right, so we're going to get a nice little bite there, come out of the same sort of position. Just check we've still got this on, centralizing the screen. Okay, and we got that there. Okay, and then we can just tie it as normal with our surgeon's knot. And you see the knot is coming down distal to that flap tip, so it's not going to strangle the tip. And we're not pulling too much on the tip, but it's going to pull it in position. Okay, so let's go for that like there. I'm going to use this tension suture again. And we're going to get the balance and tight and not too tight. That's probably about right. Probably about right. Yep. And then finish it off. Okay. So then, nice and flat. So let's see where we are. Nice dimples from our buried stitch. That's together. This tip has been traumatized a little bit. That's from my incision, I think, but it's in good position. And the stitch is coming across there for the knot, but then it's going through the end of that. So that's a really nice position. It's cured that sort of flipping up that was happening. And then we would do rule of halves here. So one there, or maybe I would probably do one there and one there, probably do another two on each side at least. So you really want that to be nicely bedded down and everted. That's going to be the key to a good result. And then you're going to just trim these bits, make sure that's all in together, another little buried stitch there, and then run round with a running stitch, and that's your island pedicle flap with the traditional undermining technique.